Welcome to our interview series from the Community of Practice for Global Health R&D, a joint initiative between the Global Health Center at the Geneva Graduate Institute and the United Efforts for Innovation, Access and Delivery. Today, we spotlight EspeRare Foundation, a not-for-profit organization based in Geneva, Switzerland, dedicated to developing treatments for rare diseases in children. EspeRare fills critical gaps by merging scientific expertise, patient advocacy, and collaborative partnerships to improve access for underserved patients. We spoke with Caroline Kant, Executive Director, and Sebastian Matsuri, Prenatal Platform Development Director, to learn about EspeRare's collaborative approach. EspeRare is a private organization with a not-for-profit model designed to support its mission of advancing both innovation and access. In this video, we discuss how their collaborative model enables this practice by bringing together stakeholders such as patient groups, funders, and industry actors that share in both the benefits and the risks of innovation.
The point about what is often a big challenge in rare diseases is really this fragmentation of stakeholders and activities between academia, drug developers, patient organizations. So when we have thought about creating a tailored model for rare diseases that combines the pharma drug development know-how, but also this non-for-profit footprint where we really focus on the needs of the patients and looking at accessibility down the line. One of the big drivers is to have established a venture philanthropic model. So instead of being a for-profit biotech, we are a non-for-profit biotech that is able to mobilize philanthropic and public funding and combine it with our pharma know-how to give a chance to therapeutic opportunities that would not be sufficiently attractive at the time we start developing them for a classical commercial drug development entity. And it's by de-risking with philanthropic and public money and being able also to align patient organizations and biomedical experts in this let's say, mission-driven approach of developing treatments for rare diseases that we are able to mature them sufficiently and de-risk them sufficiently so that they can interest pharma partners. When we de-risk these opportunities, then we also generate R&D returns from these activities that are on the form of milestone payment that our commercial partners will provide to us, and also royalties down the line on the sales of the treatment. And to be in line with our mission-driven model, these quite substantial financial returns, we share them with the patient community and the biomedical experts because we feel that to consolidate this collaborative approach to drug development, we need to be in an approach that is risk-sharing, value-sharing. But on top of that, we feel that, for example, the patient community is the best place to know how to reinvest part of these returns to impact best the community. So, for example, with ER004, we are in a disease that needs to be diagnosed before birth, because we treat before birth, and that's a world first. And one of the most pressing questions will be to be able to enhance the diagnosis of this patient before birth. So by being able to give back some of our financial returns to the patient community, we believe that this community will be much better placed to be able to advance diagnosis of the disease, will be also able to advance being able to measure in the most impactful way how our treatment truly impact the patient, but also the healthcare system. And in terms of our biomedical experts, they are the ones that are continuing to advance the disease understanding. So by providing them as well financial means, it's really a way that with all of our complementary abilities, we advance better care for these patients, but also it's helping our commercial partner having a more sustainable market in terms of the patients we address. So it's really about aligning and being in a position as a non-for-profit drug development engine to share risk and reward, and also to bring all our complementarity abilities towards this common goal of more impactful treatments and more accessible treatments to the patient we care about.